Hello everyone, welcome to Zooming in China. I'm Simone Gao. Xi'an is a city of 13 million people located in the west of China. Since December 22nd, the city has been locked down because of a new round of COVID outbreak. The Chinese authority claimed a victory this week in its fight to contain the virus. They used a new method called societal zero out, which means the government moves all the close contacts to the infected people to quarantine centers outside the city. Thus, those left in the city will be safe and a zero COVID status can be achieved. In this episode, we'll show you some footage of Xi'an under mass quarantine, particularly how the societal zero out effort was carried out by the city authority. After that is my interview with Sean Lin, former lab director of infectious disease at the Walter Reed Army Institute of Research. These clips are collected by Inconvenient Truths by Jennifer Zeng. They show how people in Xi'an were moved out of the city by buses day and night.
1月2号的上河城，这么多大巴车，这么多人，全部拉走。
石阳农庄门口。
你看这腰的。
哎呀，我的妈呀！你看这边3排。
你看。
哟。你看。我的妈呀！
我还跟你说100辆。
我的天呀！我的妈呀！我们家的这个小区我都不敢回了。
你看还这多，看，这黑的就像还来了。
我的天呀！这是把我小区炸了！这是把我小区炸了，吓死人了！哎呦，我的妈呀！太可怕了，太可怕了！
This video shows a woman had a miscarriage because she was not treated.
我在高溪医院这门口嘞，这是高溪医院。
这让孩子在这儿睡着，睡到家，我天，2排加床，头挂。
我前几次翻出的原因是因为，包括这一次原因是因为我家里没有什么吃的了，我要去超市买一些东西吃。但是因为而且在网上买菜就是老抢不到嘛。
This one shows people were walking back from the quarantine center because the condition there is unbearable.
咱也配合的政府听党的指挥，但是希望确实能给咱。
饮品免费了，隔离点设施太差，都在往回走，警察也管不了。
Now let's see my interview with Dr. Sean Lin, former lab director of infectious disease at the Walter Reed Army Institute of Research. Sean, thank you for joining Zooming In today.
Simone, my pleasure to join your program. Thank you for inviting me.
Okay, let's talk about China's CovidZero policy and the situation in Xi'an. Today is the 15th day of Xi'an's lockdown, and I just saw a video uploaded today by a person from Xi'an, and you can see the streets are still empty. And the government said the risks of large-scale rebound of the virus has been reduced to the minimum thanks to their policy. So do you think their COVID-0 policy worked once again in Xi'an?
I think first, China's zero-out policies never worked in the past. So many people think the Chinese government had a successful zero-out campaign when they deal with the Wuhan's outbreak last year in 2020. But I don't think that was actually a successful example because the government's concealed information regarding how many people were hospitalized, how many people had severe disease, and how many people died, especially the death toll was a top national secret by the Chinese government. So we don't know how they actually contained the epidemic in Wuhan. And after that, the death toll nationwide for Chinese Communist parties, it's a it's a puzzle. It's a mysterious low number that is abnormal. Nobody can believe that the attack rate, the death rate for such a epidemic disease will be such a low level. It's impossible. So government worldwide may not think deeply or may not realize that they subconsciously thinking that the Chinese government had a successful way to deal with the epidemic. So many governments have been using different lockdown policy, try to mimicking what Chinese government did in Wuhan. So actually, I think that's a very bad example. And now I think in...
Oh, okay. Just before you go to more details, I mean, the Chinese government, obviously, they, cover the truth all the time. But compared to other methods, maybe the Chinese government thinks that the quarantine, the lockdown policy, zero out policy is still the best out of all the other policies. That's why they're using it. And otherwise, they don't have to use this method, right?
I think
so.
This is actually an ideological issue. For the Chinese government, they are not treating the Chinese people as a normal human being in terms of in the disease outbreak control situation. To me, the Chinese government is treating the Chinese people like livestock, like animals. So in essence, they are not doing human infectious disease outbreak control. They are more like doing animal or livestock epidemic control. The reason I'm saying that is because that policy-wise, you can see they are almost very similar. If you look at China's animal disease control legislation as well, what China's current policy for zero out the COVID in a human society is very similar. They also organized different teams at different government levels, and they also emphasizing the local government official need to be responsible for the epidemic, and they also emphasize that need a big data to help control the disease outbreak situation, and emphasizing the great management, right? So for just like you growing cattle, right, in different breeds, different regions, even in the same animal farm, you can have different breeds. If that particular breed has a disease outbreak, you can take care of that breed particularly, right? And similarly, they're using the same ideas in the society too. So any cities, any particular district have an outbreak, they can transfer 2,000 people overnight to an isolation facility. This is almost exactly like treating animals, right? If you identify a cage, a grid of animals, whether it's poultry or pigs, have a potential outbreak, and you can quickly move all these animals to a particular location, isolate them. And if the worst case, it's a large scale cooling, whether it's killed in the poultry or the pigs, right? So it happens a lot in China, especially. China has so many different bird flu situations, outbreak, or swine fever, like African swine fevers, foot and mouth disease outbreak in China in the animal facilities, right? So Chinese government very familiar with these animal control measures, and now basically they push this concept and measures into the human society, right? So you basically can see the Chinese government don't care about whether the human being has their own self-consciousness. They have their own organization capabilities, right? People can organize self-help within the communities, but Chinese government do not want any of these happen. They just treat like animal. You are a potential host for infectious disease. You just like an animal, right? So the government have all the rights to deal with you. They can order you to a isolation quarantine place overnight without any preparedness, without any further earlier advanced notice, right? Just like the Xi'an lockdown, just within a few hours, a city of 13 million people can be pushed into a lockdown, a very hard lockdown. And then later on, even more extreme, people are not forbidden and people are not allowed to go to the street to purchase their own groceries, all these basic needs, right? So it's very, very extreme. It's treated like animal. So anytime I want to wipe out you can say the government was zero out infectious disease, they can also use these very, very hard tactics to push people into a quarantine place. So they can say, well, now we're building a facility for 5,000 people quarantine, a special place to like a concentration camp to lock down people, and whether there are enough medical support, food support, logistics support for such a temporary facility. The government say we deal with those issues later. That's why now in Xi'an city, you can see so many people cry out on their social medias, talk about we are hungry, we are starving, right? Because the government promised food, but it's not there.
Yeah, I believe what you described is what they call, the societal CovidZero policy. And this is different from the previous one that they implemented, which is a absolute zero out policy. So this societal policy basically means that they quarantine all those who had close contact with the infected people. Therefore, in the future, any new case will be from those who were quarantined. But in the regular communities, in the big cities, they will reach CovidZero. So I have a few questions. How do you compare this new policy with the old one? And does the new policy, the societal CovidZero policy, work?
Okay. So first, let's look at what's the old policy. You talk about the absolute zero out policy. So actually, later in the year of 2021, a lot of the Chinese officials, media, using the term, they call it dynamic zero out, because they know even for absolute zero out policy that the central government defined is very hard to implement. So you see in China, throughout 2021, so many different outbreaks in different cities, in Nanjing, in Henan, so many different cities, right? I have outbreak, even though the government's official data always a very small number, in dozens sometimes cases in the big city. But it never totally quench out. So the government know very clearly it's impossible to do absolutely zero out. So later in 2021, they start to use the term more about dynamic zero out. That means for a city, you can, for a period of time, it can be zero out, right? It's dynamic. So it's kind of like, if I give a scenario, just like you dealing with a trash, right? If you move your trash to your neighbors, your own home is temporarily trash zero out. But the next day, if the neighbor moves the trash back to you, he is zero out, and then you have new cases. So, so this is a dynamic zero out, and this also still doesn't work out. And especially in the Xi'an situation, they clearly know. For such a big city, 13 million people, how do you move those cases away, right? So, and especially when it has already have community transmissions, you have more cases in Xi'an. So in this way, so they create a new term called societal zero out. So basically, that means if I just store the trash in other people's home permanently, then my home is always zero out. That's societal zero out. So you are not counting those people being quarantined as my Xi'an people, my own residents, basically, right? So those problems can be dealt at different county level, city level, smaller city level, not in a big city like Xi'an. So that means societal zero out. So it's a ridiculous policy. And actually the term, when they create a term, it means their absolutely zero out or dynamic zero out policy doesn't work. So they, the local official government have to create this term in order to meet the high demand from the central government, because the central government want them to totally zero out in 4 days. So, but in Xi'an, all the public health officials, including the CCP leaders in the local level, they understand this is impossible, mission impossible. So how do they deal with the central government's pressure? So they created this societal zero out and move, tens of thousands of Xi'an people to other neighborhood counties, nearby suburban areas. So in this way, they basically try to please the central government. So that's how ridiculous the situation is.
Yeah. I mean, we know what the CCP is doing, but let's just give them the benefit of the doubt. To me, I mean, if they have any reason to, the right reason to do this is because they think if we quarantine all those dangerous people, they're not infected yet, but they, potential COVID virus carriers. If we quarantine them into one place, then it's easier to manage these dangerous people, and then the rest of the community is clean. So our effort will be more directed, more focused, and easier. What do you think?
Okay. Yeah, from the surface, of course, this rationale, it makes sense. But the key is how you implement it. You can quarantine a lot of people, but the key is that you need to think comprehensively how to support people, both logistically, medically, even mentally. How do you support a large amount of people in isolation, quarantine situation, and how do you ensure people have some like comorbidity, disease? How do you help them overcome this kind of situation, right? So you won't just suddenly announce a lockdown in a few hours, and not in the such a scale. So how do you prevent secondary disaster? This is always one of the top issues when you're dealing public health crisis. You have to avoid people being injured, physically, mentally damaged because of the quarantine policy or isolation procedures, right? So
Yeah,
it
I
should
have
be
another.
a humane process, but the Chinese government doesn't care about that. That's why I said it's not exactly treating people as human beings.
Yeah, I have another question. These people, dangerous people, might be infected. If you put them together, wouldn't the chances of them cross-infect each other be bigger, and they could be, the center of the spreading of the virus?
Yes, that's why I said quarantine is not a simple thing. Isolation facilities and quarantine facility, you need to specially build, right? Even in the past, even if you remember in Wuhan, when they built the Fanchang hospitals, the temporary hospitals hosting thousands of people, at the time, the Chinese government still talk about how advanced facility is, right? All kinds of air filtering system, how do you mobilize medical people to support. But now in the year 2022, there's no such issues. As long as you push people to a temporary quarantine location, as long as you do in the societal zero, the local officials feel happy about it. I deal with my problem already. Right? So this is very different, and that's why I said it's not the simple procedures to quarantine large amount of people. That's why in the past history, governments are very careful to implement any of these kind of policy.
Okay.
Put large amount of people into quarantine facility, it definitely will create high potential of cross-contamination, cross-infections, higher rate of transmission of the same infectious disease. And it's a very bad situation.
Yeah, if that happens, what do you think China will do?
So that's why I'm really worried about what will be the next step. So if we think about how people handling animal disease outbreak, right? So worst case is mass cooling, right? So if you have, for example, if you have a H7N9 outbreak in the poultry, in the chicken, the breeder can decide I will kill maybe 100,000 chickens, birds, right? So and then if there's for example, African swine fever outbreak in your pigs populations, you can decide I kill 50,000 pigs. So that's cooling. Of course, when you massive killing a lot of people, you will temporarily block the disease transmission. And this part, this kind of measure, Chinese government is very familiar with. And maybe it's a bad omen. The Chinese CDC's director, Gao Fu, he's a veterinarian. He's not a medical doctor. He's a veterinarian, right? So the Chinese government can always treating, okay, these population of people, they are potential hosts for a big infectious disease, whether they are close contact or they are the close contact of close contact. They are just a block of people. These are people dangerous people. Let me quarantine them, and whether they can survive this kind of isolation, they don't care at this moment. So that's why I really worry that the secondary disaster due to these very hard-tactic isolation procedures will kill many people even starving to death, or they have other disease that they bearing at the same time, right? Comorbidity issue will be very high.
Yeah.
So this is very, very inhuman process, and no government should follow Chinese government's this kind of example. And I believe the Chinese government try to push this idea to other part of the world, saying, you see, we do a very effective way in controlling this disease, and they even brainwash more Chinese people to believe that your sacrifice is important for the whole country. Right? So they are very successful in brainwashing people, and many people, as long as they not starving, they don't think the people in Xi'an in quarantine was your sympathy. So that's a very bad situation.
Yeah. And this new wave in Xi'an is mainly the Delta variant, and the Omicron variant hasn't reached China. Will it reach China eventually? And if China still uses the CovidZero policy on Omicron, what do you think will happen?
I actually don't know whether Omicron has been spread out in China or not. There were reports talk about Omicron cases being identified in China, even though are very small numbers. But we don't know what's the true situation. The government told the public what's causing the outbreak in Xi'an is Delta variant, but we didn't see enough data regarding how many people were hospitalized, how many people having severe disease. That's the whole pattern showing similar pattern to the Delta outbreak in other countries, or this is actually more similar to Omicron outbreak. We don't know. The government didn't provide this information. None of the hospitals treating the COVID patients were allowed to give the data to the public. So how do you know what's the true causes of the outbreak in China? So I actually suspected with the very, very powerful transmission rate from Omicron probably already spread out in certain regions in China. And that's why the Xi'an or Zhengzhou in Henan province, the public health officers, the local CCP leaders were so scared about this wave, and they used this extreme tactic. They may not just tell the public now it's Omicron, and they don't care that Omicron maybe right now doesn't cause very severe disease compared to Delta. Omicron right now basically showing less trend to have severe disease globally in different regions, whether in South Africa or in UK or in the United States. The Chinese government don't care about it for the local Chinese official, because the central government's order is to zero out the COVID, right? So as long as they're being tested positive on this nucleic acid test, the local official have to be responsible for this community outbreak, whether it's Delta or Omicron. So they just use the same extreme measures to try to wipe out these numbers. I say numbers, right? Because they are not really treating the disease, not treating the people. They are just cared about the number.
Yeah, I've seen the Chinese media reports saying that this wave is the Delta variant. Let's just say that report is accurate, but if they are one cycle behind the international epidemic cycle, now that Delta and everybody else is Omicron, does that have an impact?
Well, I think it's almost impossible China can be a unique island for Omicron. The way the Omicron spread is so fast. I don't think China zero campaign can block Omicron. I don't think China stand any chance for that.
Okay, so if Omicron reaches China, if they still apply this zero-out policy, they will be in big trouble, even more chaotic than now.
Yeah, definitely. I think they are already in trouble in dealing with Delta. With Omicrons, and it will be spreading much faster, especially if you put thousands of people in a temporary quarantine places like a garage. So many people will be infected. And actually, I see some social media posts talk about people who actually want to be isolated. The hospital refused to accept him, and then 8 members from his family actually all got infected. Yeah, so there are ridiculous extreme examples like that in Xi'an. So anyway, I don't think the Chinese government can contain Omicron. No countries can contain Omicron. Nobody believes the human being can contain Omicron spreading right now. So I don't think Chinese government can stand any chance to successfully zero out Omicron.
But the Chinese leader Xi Jinping, at least for now, he is still insisting that China should apply this zero-out policy. And anybody who is opposing this policy, he gets very angry with that person. So, how do you think this zero-out policy play out in China in the future? Do you think they will stick to it to the end?
Yeah, I think yes. I think Xi Jinping will stick out to his policies, because any change of the policy will strengthen his his positions, and in the critical year, re-election year, right? Let's call it re-election simply. But anyway, I don't think he wanted to change the policies. But at the same time, maybe the Chinese government will be lucky because even a lot of people got infected with Omicrons because many people were not showing severe disease. The Chinese government can always say, "Oh, see, not many people die, and they've been successful containing the disease." The Chinese government can always tell a good story to the public so that people still believing the Chinese government did very good. Very people being sacrificed in Xi'an lockdown. What you read on the internet, just a small sporadic situations. It's not a systematic happening. People were being treated nicely. The government can do all these eulogies after this hard lockdown. And right now, they're probably very worried about the Winter Olympic in Beijing. That's why Beijing implementing 56 days quarantine for any inbound travelers. So this is very extreme, right? No scientific reason for 56 days quarantine. But that basically tell the world that the Beijing want to quarantine you the whole period until the Winter Olympics is over. So basically, that's how they contain the situation. And so the Chinese government will tell Chinese people a good story. We have successfully held a Winter Olympics. You see, we contain the situation. We don't have maybe athletes got infected. They can always tell this kind of story to people and then boosting the CCP's image to people, to the world, saying they are the very successful example, even though the Chinese society suffer a lot. And they try to further prove the dictatorship, the authoritarian style the Chinese government represents actually have a better advantage than the democratic system. That's their whole eulogy. They're already preparing, and then they will carry out this campaign exactly in this way.
So if you were the guy who is, overseeing China's pandemic control, what do you think you would do?
I think with the normal human thinking, you need to think about how to help people overcome this disease in a rational way. And if you see the globally, all the scientific evidence or medical evidence showing the spread of virus so strong and such a strong immune evasion, so many people cannot avoid being infected by this wave of Omicron. Then you need to think about how human society can coexist with the virus. How do you avoid hospital system overloaded? And then how do you quickly using different other maybe on-shelf drugs to help people reduce their symptoms, all these kind of additional measures or even other non-pharmaceutical intervention measures that you can implement to support the society, and how do you reduce the mental stress that people have in this kind of pandemic period. These are all very challenging tasks, very important tasks, and you can all do it in a very humane ways. And I think the key issue is whether you have a human heart, have a human mind or not. And I don't think the Chinese government doing it in a humane way, in a human way.
Right. Well, Sean, these are all my questions. Do you have anything else to add?
Well, I think that's it for me right now. It's really thank you for inviting me to have a comment on this situation in Xi'an.
Okay, thank you, Sean.
Thank you very much.
That's it for today. Let's pray for those Chinese people and hope things get better soon. Meanwhile, please like, share, subscribe, and donate to this program if you like my content. My website is zoomingin.tv. Be sure to check it out. Thank you, and I'll see you next time.